So you can start now.
Good morning from Goa, my home, where I have been locked down since the last 2 months or more. I'm going to be speaking to you about mental health in the era of COVID-19. There has been a great deal of interest in the subject of mental health, and there is a good reason for that. I want to really discuss the subject of mental health in two different phases. The first is the phase that we're currently in, where the pandemic is still upon us. We still have a long way to go to negotiate it. During this phase, there has been a great deal of anxiety regarding the pandemic, and mental health has therefore become a key concern. Let me clarify that this is not because of any direct impact of the virus on our brain, but it is almost entirely the consequence of the reaction of the media and the government to this epidemic. Very poor communication, I think, has been very central to this. For example, the initial communication about the epidemic to the population was one that suggested that this was a very deadly disease, that all of us in the community were likely to die if we were exposed to this infection. Even though we already knew right at the start that only a very small fraction of people would suffer a significant illness, less than 1% in fact, and a significant proportion of those people would be older adults, often with other medical problems. If this had been communicated much more clearly, I believe there would have been much less anxiety and fear. And in part, this anxiety and fear has also led to discrimination and stigma against a whole range of different groups in our community, not least healthcare providers. Indeed, if one adds to this the fear of the disease, the loss of loved ones, because of course the disease is killing people, the loss of employment, and I'll turn to that in a moment, the constant uncertainty about when, if ever, life will return to normal, whatever normal might look like in the future, the torrent of mixed messages about the science around the virus, both the real as well as the fake science, and the complete lack of consensus. If you think about India right now, we have 30-odd states, each of which is on its own post-lockdown exit strategy. In fact, it shows us that there wasn't, in fact, a well-thought-through exit strategy at the very beginning. You think that when you put a country into lockdown, you already know what the exit strategy might look like. We are making it up day by day. And of course, this instills a lot of anxiety in people because we trust our leaders and our scientists to know how to manage an epidemic. And it seems like everyone is on a learning curve right now. In this context, it isn't at all surprising that experiences of anxiety, fearfulness, sleep problems, irritability, and feelings of hopelessness have become widespread. In fact, these are, in my mind, rational responses of the human being to the extraordinary realities that we're facing. It's very important here to emphasize, therefore, that we should not be medicalizing these mental health reactions because these are rational responses. And instead, what we need to be doing is engaging the community with clear, consistent communication, clear planning on how the community is going to come out of the lockdown, and importantly, the risks that that poses in terms of the infection spreading, which it of course inevitably will, and how the community together with the state can actually try and limit the spread of the epidemic and optimize safety, particularly for those who are most vulnerable, such as, for example, the elderly. But there is a second phase in which mental health is going to become even more important in the future. And that second phase will arise in the weeks and months and indeed years ahead when the pandemic will soon become just a memory. Let me be clear, the pandemic will be a memory. Civilization has seen many such pandemics in the past, and they're all just historical footnotes in our history. This one will also be a historical footnote. But what will not be a historical footnote is the tremendous economic recession that the containment policies, the lockdown in particular, not just in India, but more globally, has created. By any account, hundreds of millions of jobs in India and around the world have been lost as a result of the lockdown. And a very large proportion of these jobs will never return. Not only have jobs been lost, but there has been a tremendous widening of inequalities in countries. And there is a continuing uncertainty about future waves of the epidemic. All of this, combined with the physical distancing policies, will bite deeper into the mental health of populations. And this is not surprising because we know through historic research that there is a very strong association between unemployment, acute poverty, and indebtedness with poor mental health. A recent book reminds us of how powerful this association is. This book was authored by the Nobel Prize-winning economist Angus Deaton and his colleague Anne Case from Princeton University. The book is entitled The Deaths of Despair. And the book documents the causes of the increased mortality and reduction in life expectancy in working age Americans after the 2008 the economic recession, which was due to the global financial crisis. Of course, this was not truly a global crisis. It particularly affected the US and a few other countries where there was very weak regulation of the financial sector. But there was massive unemployment as a result of this financial crisis. And what this book documents is the falling of life expectancy in working age Americans who found that not only did they lose their jobs, but those jobs never returned. There was a loss of hope, a loss of purpose in the lives of these young working age people. And as a consequence, depression and substance use became very common. Much of the loss of life was due to substance use, related mortality, and suicide. What we are seeing now in the COVID-19 era is going to be much, much worse. Because this economic recession is not restricted to one or two countries, it is truly global. In India, it is estimated that at least 300 to 400 million Indians who live as daily wage laborers or in small businesses will see their incomes dramatically reduced. There is, of course, not only the rise of absolute poverty, but also in countries like ours, there is a very weak social security net, in fact, almost absent social security net, and a very fragmented healthcare system. This combination is toxic. Absolute poverty with rising levels of inequality, and is a potent brew for a similar surge of deaths of despair in this part of the world. And let me just say one more thing about India and many other parts of the world, is that the rise of mental health problems occurs in healthcare systems that were already very, very poorly equipped to deal with the existing mental health problems that existed before the COVID-19 epidemic. And the reason for that was that we had very few skilled providers, but also we were using very narrow biomedical models that dominated the landscape of mental health care. The little bit of mental health care that existed was dominated by doctors, diagnostic models, and drugs. While the problem of mental health is going to affect the whole population, I believe there's one particular group that we should pay special attention to, and that is young people. The reason for this is that young people are the most important demographic when it comes to the workforce in the population. But also because young people are a key developmental stage of life where we make the transition from childhood, when we are completely dependent on our parents, to becoming independent, autonomous adults. This is the phase where we complete our education, our university, for example. This is the phase in which we look for jobs. This is the phase in which we form long-term relationships with partners. All of these key social transition roles have been completely disrupted by the lockdown. And as a result, young people's lives have been literally thrown under the bus. And ironically, of course, young people are the demographic least affected by the virus itself. Why is this particularly important from a mental health perspective? Isn't only because their lives have been completely disrupted, but also because youth is the period when most mental health problems have their onset. 3 out of 4 of all mental health episodes in adult life have their onset before the age of 24. And indeed, it is in this age group, mental health problems are the leading causes of sickness and death, both in the form of suicide as well as substance use related accidents. Now, What are the positive things, if there is anything positive that's come out of COVID-19 and the mental health concerns that emerge from that, is the flourishing of initiatives to address the rising tide of mental health problems, especially through telemedicine platforms. The real advantage of these telemedicine platforms has been that it's helped improve access to mental health care to people who could otherwise not have been able to visit a mental health provider. It's also been terrific in terms of emphasizing the importance of psychological treatments or counseling therapies. Because as I mentioned earlier, one of the real limitations of mental health care so far has been the dominance of medication. And even though psychological therapies are amongst the most important of all mental health interventions, in fact, they're amongst the most important of all interventions in medicine, the truth is that very few people were able to access them because there's no real commercial incentive for providing psychological therapies. There isn't a drug company, for example, that will promote these particular interventions. And most psychiatrists find it too time consuming or indeed are not even trained in providing these psychological therapies. There are very few other kinds of psychological therapists available in the world. This brings me to the limitation of the telemedicine platform, which is that they rely almost entirely on specialist providers who are already very scarce in number. Now, this particular limitation, this particular barrier to improving access to psychological therapies, that is the absence of skilled providers, has been an issue that I personally have been very deeply involved with trying to address. And over the last 10 to 15 years, my team in India, led by the organization called Sangat, but also in parallel, similar teams working in many other developing countries around the world, low resource settings around the world, have been innovating in dramatic ways to show how these kinds of very effective treatments could be delivered by non-specialist providers. And over the last 10 or 15 years, dozens of high quality clinical and public health studies have shown that ordinary people in the community, non-specialist providers representing a range of different human resources, from peer support workers, community health workers, and even just ordinary lay people, with carefully designed training programs followed by supervision, can effectively deliver psychological treatments for a range of different mental health problems, such as depression, anxiety, alcohol abuse, and trauma-related mental health problems. This is one of the most transformative and exciting innovations in all of medicine. And certainly, it is the most exciting innovation in mental health care. So exciting that what was just an idea 10 or 15 years ago is now being advocated by both national policy instruments, such as the National Mental Health Policy in India or the Mental Health Care Act in India, but also globally by UN agencies. The UN Secretary General himself wrote a very wonderful policy brief, which I really recommend you all to read for those of you interested in how he thinks about improving access to mental health care, by the World Bank, by the World now calling for the scaling up of this evidence, the evidence that community-based workers with no mental health professional training can greatly expand the reach of the mental health care system with appropriate training and supervision. In my own work, I'm seeking to use digital platforms. There's a program that we launched called Empower, which is seeking to use digital platforms and the wonderful learnings we've had over the last decade from open access online courses to digitize the learning of these different psychological treatments so that any provider anywhere in the world, especially obviously the only limitation is language, but in India, for example, we're working in the Hindi language, in the US, we're working in English. And so if you look at these two languages as our initial offering, you can imagine that we can reach a very large proportion of people around the world. We are digitizing the curricula for 3 core competencies: the assessment of mental health and decision making, the management of acute crises, which of course are very relevant in the era of COVID-19, and the treatment of depression, digitizing a 6-session treatment that we innovated and tested first in India and then a treatment that's been replicated in other parts of the world. And what's really exciting about Empower is that we're doing this simultaneously in a very richly resourced country, the US, and in a very poor resource country, India, so that we can demonstrate how the same approach can be used in two very different contexts to scale up mental health care by building the mental health workforce. Empower can be used for a number of other mental health issues as well. We have a separate group in our program which is working on children's mental health, particularly on early child development, as well as on adolescent mental health. And a key aspect of Empower, which is an initiative really of Harvard Medical School, is that we are really starting with evidence-based brief psychological interventions that randomized controlled trials have shown can work in the real world when delivered by community health workers and other non-specialist providers. The use of digital platforms, of course, for building the workforce is not only aligned with the use of telemedicine, but also with the urgent need we have for digital approaches for training and supervision, especially relevant in the light of the physical distancing policies that prevail now due to COVID-19. But of course, we will need resources to realize this audacious transformation, taking the science that now exists and bringing it to scale. And here we need to anticipate the biggest threat to mental health consequent to COVID-19. And that is, in spite of all the conversations and recognition of the importance of mental health, the truth is mental health risks being pushed back into the shadows because of the lack of money. I recall this happening way back in 1998 when I was invited to the World Bank. At that time, there was the first global burden of disease report that had been published that demonstrated, much to the surprise of everyone, that depression and other mental health conditions were amongst the leading causes of the burden of disease globally. And in 1998, I was invited to come and speak to economists at the World Bank to consider how this particular evidence could be responded to. At that time, we actually did not have great evidence about the use of community health workers and non-specialists and lay people in mental health care. Still, there was an interest at the highest level of global development on how we could respond to mental health problems. But unfortunately, the Millennium Development Goals that were published in 2000 made no mention of mental health. And of course, mental health slipped back off the table of priorities. 15 years later, mental health has found its place in the Sustainable Development Goals. But unfortunately, now, in the first half of 2020, once again, all health issues other than COVID-19 are risked being pushed back into the shadows. And we must be alert to that and keep arguing for the fact that not only is mental health a very, very important part of the COVID-19 agenda, but also that we have today the most incredible evidence that shows how we can scale up psychological and social interventions, even in places where there are no specialist providers. I want to conclude by saying that investing in mental health is an investment which not only enables the individual to regain hope for the future and the necessary cognitive capabilities to be effective in their work and personal lives, but collectively, the impact will be felt at a community level by making society more economically productive and also more socially cohesive. I cannot think of a more important investment in the face of the most serious crisis facing the world in a century. And here we have the most amazing opportunity of all. We see hundreds of millions of people being put out of work because of the lockdown and the COVID-19 containment strategies. At the same time, we see an unmet need for care that has been unparalleled in history. And we have this amazing evidence that people with appropriate training and supervision can actually deliver psychological and social interventions to meet that need. What a tremendous opportunity we have to meet two huge crises that we are faced with: unemployment and the unmet need for care. Thank you very much.